Hey, this is Amin Al Jawadi, and today I will be presenting my PowerPoint about the radiology perspective of coronavirus disease 2019. So, to start off, this coronavirus COVID 19 started off in China. It infected 2,796,113 until today. This number includes both active cases and closed cases, which include deaths and recoveries. Um, Despite the precautions taken in many countries around the world, such as quarantine and social distancing guidelines, the coronavirus is still rapidly spreading with human to human transmission. Because similar pulmonary syndromes were reported from other strains of the coronavirus family, which include COVID 19, MERS, and SARS, and no enough information is present about COVID 19, a lot of the imaging studies of MERS and SARS are used to familiarize the radiologists with the conditions since they are very crucial to help in diagnosis, monitoring the progress, and the follow up of COVID 19. So, what is the role of imaging in the diagnosis of COVID 19 cases? So, chest x rays and CT scans play a very crucial role in this COVID 19 outbreak. These forms of imaging help in the diagnosis, progression, and follow up of the patients. It has a major impact in helping with diagnosis, and this is backed up by a report that stated that 5 patients with confirmed COVID 19 cases were tested negative for COVID 19 initially on the swab test, but were later tested positive on the CT scan, and this highlighted the value of CT scans in the diagnosis of COVID 19. COVID 19 can also be diagnosed using a chest radiography and normally shows patchy or diffuse asymmetric airspace opacities. It is mostly bilateral, unlike MERS and SARS. Bilateral means that it affects both lungs with a consolidative, which is even more opaque than patches and more severe, of course, pattern seen in patients in the ICU, so which is the intensive care unit, and a predominantly ground glass pattern in patients who were not in the ICU. It also helps in detecting the ground glass opacities and consolidation. Next is the prognosis of COVID 19. So chest X-rays and CT scans also have a major role in detecting the progression of COVID 19. These show the progression of abnormalities or can indicate a recovery. Indication of poor prognosis can include the production or increase in consolidations, as well as increase in ground glass opacities and patches. A case study that involved a 47-year-old Chinese man after 2 days of his initial CT scan, which indicated that he had small round areas of mixed ground glass opacity and consolidation bilaterally initially. Um, then indicated an increase in both ground glass opacity and consolidations, which showed poor prognosis and helps the radiologist remain in control of the condition to determine the next step for the patient. Older age and progressive consolidations may suggest poorer prognosis. So finally is the follow-up on COVID-19. Besides the acute phase, CT is recommended for follow-up in individuals who are recovering from COVID 19 to evaluate long term or permanent lung damage, including fibrosis, as seen with SARS and MERS infections. The use of CT scans and X rays in COVID 19. So, the proportion of clinical mild type patients with COVID 19 was relatively high. The CT visual quantitative analysis has a high consistency and can reflect the clinical classifications of COVID 19. The chest CT helps in determining the progression of the disease and is 85% effective in diagnosing COVID 19. The CT scans were very helpful, especially in those who were falsely negative on RT PCR or the swabs, or they can be without symptoms. So, now coming to lessons learned from MERS and SARS. So, we can use MERS and SARS as references to learn and understand more about COVID 19. There are many similarities between MERS and SARS since they all belong to the coronavirus family. CT frequently shows patchy areas of ground glass opacity and consolidation, which is a similar feature to what is present in COVID 19. Similarly, in 83% of the patients with MERS, the findings on initial chest radiography will be abnormal, which is similar to the 85% of COVID 19. Besides the acute phase, CT is recommended for follow-up in individuals who are recovering from COVID 19 to evaluate long-term or permanent lung damage, including fibrosis, as seen in the SARS and MERS infections. So on this slide we have a normal versus infected lung using the lung imaging. So these are both axial views of the lung. One of them is normal, the one on the left, and the right one is the infected. So the first one is perfectly normal lung. The one on the right, if you can see the differences, there are some ground glass opacities or patches bilaterally on both lungs. If you can see the laser I'm pointing right here and right here, these two places, and also around the peripherals there is a bigger border, because you can see normally these patches occur peripherally, and some of them are all around these two bilateral lungs. So now coming to the phases of COVID-19. So there are four main phases, two of which I have pictures for. So the first one is the early phase, which is the first 0 to 4 days. So we have ground glass opacities, GGOs. We have partial crazy paving, and we have a lower number of involved lobes. Then we go to the progressive stage, which is like 5 to 8 days, about 5 to 8 days. We have an extension of these ground glass opacities, and we have an increase in the crazy paving pattern. Then to the peak stage, which I also have a picture of right here, 10 to 13 days, and we have consolidation that occurs. And as you can see in the rectangle portion, we can see the consolidation right there. Then finally the absorption stage, which is more than or equal to 14 days, which is gradual resolution, so hopefully the patient will become better and better. And finally the references to these websites, APA cited. Thank you all for watching and listening.